Infinity White, and today we will be talking about care coordination. And in today's discussion, um, first of all, I'd like to introduce myself. Again, Infinity White. I'm a registered nurse and I work in Florida on Med-Surg. I have a plethora of experience working Med-Surg, ICU, oncology, and now I am currently a labor and delivery, mother baby gestational diabetes nurse, case manager. With nursing care coordination, we'll be discussing that today. For the patient to achieve the best potential healthcare outcomes, nurses must be able to comprehend and address each patient's distinct and varied requirements across the whole healthcare spectrum. And we'll go over this later in the presentation, but the best practices for working with patients and their families to optimize healthcare delivery and to make sure the intended healthcare outcome happens, we have to coordinate and work together as a team for the patient. In order to create a smooth transition of care and have effective communication, we have to stress the importance of interdisciplinary collaboration with the patients, their families, medical staff, providers, because it goes hand in hand with curating a plan of care for the patient that works for them and benefits them. Furthermore, we'll go over further along in the presentation about the justification for coordinated care plans that are founded on moral judgment and change management techniques, as well as their effects on patient care. So first things first, we're going to talk about effective collaboration in patient-centered care. Healthcare providers must work together to create treatment plans that are both rational for the patient and acceptable for the patients and feasible for the patients as well, in order to provide patient-centered care. So for example, if we're dealing with a patient with a lower socioeconomic status, we wouldn't necessarily prescribe treatment options that aren't cost-effective and economic because of the barrier of affordability. So that's when, as a provider and as a nurse, it would be beneficial for you to know certain resources that can help the patient if they are having difficulties in that area. According to the recent article in American Nursing Association's stance on coordinated care, states that patient-centered care seeks to improve overall community health and healthcare-related cost reductions, while also achieving a better patient care experience, creating dependability, quality, and access to healthcare. And that's according to Anderson Huner of 2021. By encouraging care coordination and fostering productive teamwork, health issues can be prevented. There are tons of barriers, socioeconomic barriers, cultural disparities that can frequently make health issues worse and kind of just add fuel to the fire. But we adapt and we overcome, right? According to Swan of 2019, when providing coordinated care, it's critical to take into account factors including, like I said before, socioeconomic positions. The patient's literacy level is really important to make sure that they are able to comprehend exactly what you're trying to do for the patient, their treatment plans, and being able to assess those competency levels, different educational opportunities, housing conditions, food security, transit accessibility, demographic diversity are all cultural considerations that we must take into account when we're coordinating with different providers and we're doing patient care, planning of care. Collaboration is encouraged by a number of programs, including cultural competency and targeted drug education treatments. It encourages adherence and positive health outcomes by providing comprehensive information and instructions about pharmacokinetics. However, by asking the patient to repeat the material, you can make sure they grasp it, and in addition to using any educational tools necessary for the patient to comprehend, it is crucial to speak to them in layman's terms. According to CIDE of 2019, inquiries about any cultural or religious beliefs that might prevent the patient from taking the treatment plan seriously should be made during this period. If there is an interaction of some sort that we have to worry about, or like a drug allergy, that should be further discussed. We take all of this stuff into account when we're assessing the patient and we're developing treatment plans for them. Change management and care coordination. Any organization that's dedicated to continuously learning and developing healthcare from a patient-centered standard, it must include change management systems as their core component, because by putting innovative concepts and evidence-based tactics into practice, keyword evidence-based is that helps support and sustain constructive organizational change that will actually improve patient outcomes. In order to successfully navigate the complex healthcare environment and ultimately promote improved healthcare outcomes and patient outcomes and patient immobility, patient immortality. These demands include dynamic nature of governmental policies. We have to be more keen and more up to date with technological advancements, disease management and the evolution of diseases, any new diseases. I know just a couple of years back we had a brand new disease, that virus that no one really knew about, and we had to have a huge change management and plan of care globally for how we tackle on this virus, what we do for patient safety, and disease management. It's much simpler for patients and healthcare workers to trust one another and collaborate as a team when fundamental components of healthcare delivery, such as putting the patient first and centering them around care, treatment approaches and communication mechanisms are changed. Nurses can deliver high quality care while advancing the values of diversity of patients and including them, and doing interdisciplinary teamwork when they are trusted. For new approaches to be successfully integrated and implemented within the healthcare system, certain guidelines are essential, according to Weimer and Stuckey of 2022. Lewin's change model is a fantastic tool for implementing change, examining what has to be altered, making necessary change, and then observing the impact of the change. According to Burns of 2019, I do generally feel like that's pretty much the basis of a lot of nursing change management models. You pretty much assess the data, you collect the data, and you implement a change, and then you observe how that implementation affects patient care. So now we're going to get into ethics and care coordination. Prioritizing ethical issues or considerations is important while organizing patient care. Nurses specifically are aware of the significance to sticking to social and ethical standards when providing patient care. We have license to protect, so we definitely uphold to ethical and social policies. The coordination of care plan involves the cooperation of the organizational policymakers and also healthcare leaders, upper management, unit management. The significance of 4 core ethical concepts in healthcare was highlighted in a recent essay that I did read, a peer-reviewed journal, and the main goals of these guiding principles are to promote health, prevent disease, restore well-being, lessen suffering, and provide a helpful bias for the effective delivery of care, of 2021. But it's super significant to adhere to the 4 ethical concepts of healthcare, and that is to pretty much put the patient first. This about care management is all about patient-centered, focused care, and and according to the American Nurses Association, discussing the significance in providing clear, thorough regulations and norms to promote ethical and competent care, particularly nurses. It lists a whole plethora of policies and evidence-based practices that have been founded to promote sufficient practice and patient turnout. The American Nurses Association discusses the significance of providing clear, thorough regulations and norms to promote ethical and competent care, particularly for nurses. The Code of Ethics was developed by the ANA to provide a guide for decisions pertaining to care management, but according to the American Nurses Association, nurses usually are to be sympathetic and compassionate representatives of their patients and their families, and we're also supposed to advocate for our patients and their families. According to Ross of 2023, making sure we stick to certain principles that make us respect a patient's right to refuse, right to patient care, and the right to make important healthcare decisions. It promotes a sense of doing no harm to the patient and creating like a fair environment and treatment for all patients. And also it kind of holds us to a standard of upholding the principle of doing no harm for the patient and making sure that the patient does no harm to self or others. Promoting the patient's sense of respect and worth requires an understanding of how an ethical approach to care coordination can result in patient trust and treatment compliance. However, it's important to understand that certain patients may not be able or ready to participate in care planning due to a variety of factors, such as there's a couple of factors. For one, health literacy. So if we as healthcare professionals, we have a thorough and in-depth knowledge about certain disease processes and treatment plans and options, and for us, medical terminology can become almost second nature. But when you're educating your patients, especially if this is a new onset of a chronic illness or an acute illness, you need to make sure that they have some type of literacy to treatment plans and healthcare, because there's patients that come from all walks of life, and there's certain demographics that have no access to healthcare at all. So with coming down with a serious illness, you could be the first point of contact for education for a lot of these patients. You also have to take into account cultural considerations and differences. This can be anything from language barriers, also to religious beliefs and cultural practices. I know that there are certain demographics that like to be looked in the eye. There are certain demographics that don't like to be looked in the eye. There are certain demographics that you have to walk in the room and greet them, or you lose their respect. So to be able to build that rapport for the patient, it would be wise to be able to have background knowledge about cultural differences and practices that each patient's and nationalities practice. Finally, cognitive impairments are can be super difficult with helping patients manage their care and their families. This is seen usually in geriatric patients, or in the event of a catastrophic event like a motor vehicle collision, where there's a neurological decline of that patient, and you are the liaison between the provider, the patient's family, and the patient all in one, and you have to, in certain cases, outsource and find people to advocate for the patient because they might not even have family. But cognitive impairments and neurodivergencies can really put a barrier on healthcare and being able for patients to have health literacy and be compliant to treatment plans. I mean, dementia is a really good example when we're talking about cognitive impairments. Sometimes people with cognitive decline don't even like taking their medications. So in the event that, God forbid, there's like a disease process that these patients need to treat, um, or an illness, if they're even refusing their medications because they're not cognitively inept or equipped, then that can cause harm for the patient. Absolutely. As a result of ethical decision-making programs, becomes crucial in integrated care plans that use a flexible, patient-centered approach that can be customized to meet the unique requirements of skills of all patients. Yeah, we're going to go into policies. As we talked about before, nursing leadership and policymakers work hand in hand with our policy provisions and coordinating patient-centered cares. Healthcare policy provisions have influenced patient experiences and their health outcomes and well-being, such as like the Affordable Care Act. When the ACA was passed in the effort to alleviate healthcare inequalities, unequal access to healthcare and growing healthcare expenditures, to improve patient outcomes, the Affordable Care Act was aimed to increase access to healthcare and just make it more affordable. However, since then there has been party disputes and it's a very complicated situation, and financial limitations have all tampered with the healthcare system since then, unfortunately, and that's still a work in progress, but I have high hopes. Another piece of legislation that affects patients is the HIPAA Act, or the Health Insurance Portability and Accountability Act. If you're a nurse, you know what that is. It's just to make sure that the only person that knows about a patient's healthcare is the patient and whoever the patient wants to know, according to Moore of 2019. But policy provisions have a significant impact on patient experiences, health outcomes, and care delivery. I'm not really emphasizing on the need of evidence-based policy making and achieve optimal health outcomes, but they are really important because you want to be able to take a policy and implement it off of data that's already deemed to be evidence-based and working and showing good outcomes for patients. So our role as nurses, in order to make sure that all aspects of patient care are taken care of and integrated, nurses are at the forefront of care coordination, and it's something that you don't need to take advantage of. Us as nurses, we plan, we treat, and we manage these patients' healthcare, health management for their disease processes. So that comes first. The patient's health and well-being has been directly impacted by their experience and their knowledge. So it's important for us as nurses to educate families and patients and other providers on key roles of the care coordination process, in order to make sure that the patient, family, and caregiver participation in the coordination process. Nurses must serve as advocates also to guarantee that the care given is kind of substantial and everyone's kind of on board and everyone's views, goals, and purposes and needs are aligned, and everyone's pretty much on the same page as far as the treatment plan. In conclusion, as you finish the presentation, it's more important to remember what we covered, which is healthcare should be patient-centered. That's number one. And we must, as healthcare professionals, be able to investigate the insights to deliver care that is evidence-based. Emphasis on evidence-based, it has to be backed by evidence, showing that it has substantial success with other patients. And it's important to remember that care coordination, to be effective, needs to alleviate the stress and help with the quality of life for patients while reducing overall healthcare costs, according to Swan 2019. And thank you for your time, and that is my presentation.